Thanks everyone that's here, that's joining us today in person in the room and online. This is one of our research seminars. It's being presented by Professor Gary Robinson. As we get underway, I'd like to acknowledge the traditional owners of the lands that we're meeting here on today, the Larrakia people. Pay my respects to their elders past, present and emerging. I'd also like to extend that respect to the traditional owners of the people who are joining online, the land that they're on today as well. But I will hand over to Professor Gary Robinson. Thank you.
Thanks a lot, Patty. Yes, my respects to Larrakia people, elders past, present and emerging. This is a kind of a bit of an update of some work I did a while ago, looking at child deaths, and in particular at suicide and self-harm. We're sort of moving towards thinking about a kind of revised project, trying to go over child and adolescent and young adult suicide deaths over the last 20 years or so. And to some extent, this is a little bit of thinking about where that might be heading and what we might be looking for. So let me just get this right. Yeah. I've got to click something here. Where am I? What am I clicking?
If you can just click that one.
Oh, it's that one. How about that? There we go. So this one is one behind. There we go. Now we're right. Okay, so NT on the far, all but one, far right, has the highest rate of child deaths in the NT, both for Indigenous and non-Indigenous kids of Australian jurisdictions, I mean. And of those in the NT, 30% were due to external causes of mortality. And once again, on the right, ENT has the highest rate of Australian jurisdictions, and again, Aboriginal children, particularly remote, but across the NT, overrepresented in those figures. Just thinking about suicide, but also child and youth wellbeing generally. There have been a number of inquiries over the years, and I was having a chat with someone in the coroner's office the other day and thinking, you know, that these inquiries we have, these crises we have every so many years, they're sort of big drivers of policy in the NT. It's almost as if we need things to go wrong and for forensic examination to occur before we can actually look at some things. But the point is our reliance on those kinds of forensic spotlights actually doesn't always lead to the best outcomes in terms of policy. And I guess that's part of what I'm observing as we go along. There have been a number of inquiries. There was an inquest back in Liu in the 90s, very much focused on alcohol, but you know, out of that, the Tiwi Health Board set up parenting programs and a range of other early intervention prevention initiatives that were quite important, but didn't, in a sense, achieve wider policy relevance. Of the 20 probable child suicides that we audited and looked at closely in 2012, there was one in Mutijulu that was subject to an inquest. One of the coroner's findings there was this was a young woman who was all through Central Australian communities. You know, she was being seen by all sorts of people. There was no coordination, and the community was in the news. It was highly dysfunctional. That was the reason for the inquest. But one of the things the coroner recommended there was a dedicated adolescent health service, which I think to this day you'd have to say is still kind of lacking. It's there, but it still represents a big need. Then there were two inquests a couple of years back, 6 deaths, 4 suicides by young women and 2 substance abuse deaths of young males. And this led to big recommendations around the formation of multi-agency child safety teams. All of the agencies copped the caning from the coroner, and it was all about coordination and so on and so forth. I think community child safety teams were already in existence, but this was sort of formalising it, getting it legislated. A whole lot of things came out of it. Then just in terms of the forensic kind of thing, we had the Royal Commission, which was not so much about deaths. It's about youth justice, child protection, reform of the statutory systems, but it's about kind of the things underlying the tip of the iceberg, as it were, of child death, you know, youth behaviours, violence, a range of other things, and overrepresentation of Aboriginal kids in both the youth justice and child protection systems. So one of the recommendations of the Royal Commission, or a kind of an overarching one, was that there be a public health approach to child protection in the NT. Okay, so let me just briefly say something about those inquests in 2020-21 for young women or young females. There was, in the coroner's view, all agency failed in their interaction with these children. There were physical and sexual assaults from, you know, puberty onwards. There was exposure to coercive family violence, intimate partner violence, controlling sexual relationships in adolescence in a couple of the cases. And in a number of them, there were escalating self-destructive behaviours, substance misuse, suicide threats. There were attempts to put, in the case of one young female, into bush mob and these kind of programs for high-risk kids. There were more suicide threats, to the point where she was pushed out of bush mob because it was impossible to keep her in there while she was suicidal, and so on and so forth. So this is where the coroner ramped up his recommendations around MAXT, which is essentially to establish teams in communities. I must admit, in the last year or so, there may have been changes I haven't quite kept up with, but maybe not. But so I might be able to tell us later. You know, agencies working together, representatives of agencies, you know, monitoring children at risk, developing community action plans, referring children and families and so on. But it's kind of like intensification of surveillance and coordination and collaboration, in a sense. They want them to be proactive rather than reactive, but essentially it's a kind of a fairly reactive kind of enterprise. And just without going into the detail about what MAXT is about, the question is whether better coordination in these senses with, you know, will have any preventive effect in terms of, you know, early intervention and prevention, in terms of even capturing those high-risk kids. And let's assume you do find some of them. What do you do about them? What services are there? They're the big questions to be asked, I guess. Yeah. So thinking about it, we need to think about what else needs to be there. I mean, I've sat in, there's a bigger question, I suppose, around this intensification of surveillance and coordination. And also, I think, in terms of the outcomes of the Royal Commission with Safe, Thriving, Connected and the attempt to reform the statutory systems, it's kind of more intense work around the statutory systems, coordination between them, referral, chasing up parents and families and so on. The question is, what will that lead to in terms of prevention, or are there unintended consequences of all of that activity? I mean, I've sat in communities myself trying to deliver a sort of a parenting program for families and so on, and had very aggressive child safety people coming after us, wanting us to hand over our data, and you know, all in the interest of coordination, you know, poking their noses into an intervention where you're working your butt off trying to get families to feel comfortable and relaxed about attending, and you have all this additional pressure to be a part of a kind of statutory sort of initiative to, or sort of statutorily inspired initiative to coordinate and to collaborate and so on. My feeling is that's not helpful and not the basis on which prevention on a wider community-wide scale needs to happen. So let's just think about those 6 young people again. So pretty well all of them, there were early family difficulties. There was loss of caregivers in some cases. There was exposure to violence and alcohol abuse in early childhood and so on. As the children grew up, in those communities, there were no parenting or family services that responded to these kinds of difficulty. And there was no evidence that they'd been engaged by any services. In all cases, there was evidence of risk behaviour, and often quite significant risk behaviour years before the deaths. So in adolescence of these girls, and thinking of them in particular, there were instances of physical and sexual assault leading up to the deaths, but there was no kind of assertive follow-up. There was no, people took at face value that the issue was whether she was sexually active or not sexually active, whatever. She was with a man, family jumped in and said, yes, she's been going with that man. The fact is the man was a perpetrator who had sexually assaulted this young woman, and sort of somehow it all got tipped around as though the issue was her sexual activity. The fact is she'd been coerced into it. Things like that. So misrecognition of the young person's needs through a lack of ability to sort of understand what was going on, to speak directly to the girls. And it's pretty damned hard. I'm not going to say that's easy to actually talk to young people, and with all the defensiveness and angst and so on, and how, you know, frameworks for doing that and for being able to engage with them and get any kind of information out of them is not readily available, and you have to build them. So there was no real assertive follow-up. There were clear instances of assault, but no real follow-up over time with those girls to see what was at. And as their risk behaviours, drinking, other kinds of sort of challenging behaviours escalated, families couldn't cope, and the family's responses became counterproductive. It was kind of victim blaming. It's her and she's doing it, and, you know, in the case of some young girls, including others, not in the inquests, but others that we reviewed, you know, there were floggings by, you know, family members and kin and all of this sort of stuff. The victim being, in a sense, blamed for her own behaviour. So there's an escalation on two fronts. On the one hand, there's more bouncing off of services that are ill-equipped to provide any help, and bouncing off the family, which is kind of blaming the child for its behaviour, rather than, in a sense, being able to understand that there's something going on there that needs a little bit of kind of empathic response, and you know, you need to tolerate the bad behaviour in order to create points of connection with people like that. Sort of no one was able to do that, and as I say, these interventions such as, you know, intensive residential care and so on were completely by the time you get to that stage, you're very lucky if you can hold these kids in anything, much less, in a sense, therapeutically deal with the underlying concerns. So that's the thing here. Now, just coming back to Vincent and colleagues did some research, just in a sense trying to narrow down, okay, what and where and what time of life, in a sense, is intervention needed. Just in general, at the top, overrepresentation of anti-Aboriginal children in child protection, and in a study of its association with youth justice and offending, the middle point there, that the median age of first child protection notification of those found guilty of an offence was 8.2 to 9.6 years. So you're dealing with kids in middle childhood, and that's when the behavioural problems start to become kind of more flagrant, and maybe in themselves are causes for a child protection intervention, and are highly likely to be associated with later risk of youth justice involvement. With suicide, it's somewhat similar. So children with repeated notifications, but in particular substantiations in middle childhood, so from earlier childhood onwards, but in substantiations in middle childhood were many times more likely, 9 times more likely to be hospitalised with self-harm than children with no child protection involvement. So that's hospitalisation with self-harm. So we've got, in a sense, cumulative risk. We've got kids with adversity in their lives, but we have, in a sense, persistent difficulty in families, persistent maltreatment in some cases, but probably persistent inability to deal with the manifestations, the behavioural manifestations of these kids' difficulties. You know, that's when they stop going to school, that's when they start running, that's when, say, the boys got onto substance misuse, all of these sorts of things. So by the time, you know, I think that middle childhood is definitely a time when we need to be focusing some of our early intervention action. Yes, the earlier the better, but on the other hand, there's a lot happens after very early childhood. And the fact is, these kids who get into the system, they're kind of bouncing. There's a sort of parallel process. On the one hand, the family can't cope. On the other hand, the kids are bouncing off the systems, and their sort of behaviours escalating in the middle of that. There's sort of parallel processes in which the difficulty is not really able to be kind of adequately responded to. And the longer it goes, the more difficult it is. So there's a kind of spiralling difficulty between families and services systems. Assertive follow-up's important. So those girls who are assaulted in their teens, you know, you've got to be able to track down what's going on then. You've got to form a connection with them. You've got to be able to sort of see whether therapeutically there's anything that can be done, but someone's got to be there for those girls. What frameworks are there for that? But it can occur earlier, it can occur later, and it needs to happen when it needs to happen. But the critical and missing capacity, I think, is the availability of services to work with families to identify needs and risks. You know, when you see families in a situation where they're kind of quite helpless in response to the sort of behaviour of the young person, and you know, sort of reacting to the behaviour rather than, in a sense, being able to find a way to establish relationships with the child, to find a way to connect with the child and to sort of divert and contain the behaviour. That's where there needs to be some kind of level of communication intervention in communities with families, supporting families. I mean, we're seeing a lot of it now with kids on the street, kids' behaviour in communities. It's not just Alice Springs, it's not just certain suburbs of Darwin. It's pretty well territory-wide. There's a lot of families struggling to care for their kids, and there's a lot of kids who are kind of acting out in all sorts of ways. You know, I suppose it's been there for quite a while. You know, I know adults who sort of grew up in the storm drains of Palmerston, and other kids, myself, who spent, you know, serious amounts of time in there from puberty onwards in, you know, Casuarina car park, you know. So there's a lot of kids out there who are not well cared for, and where there's not really any capacity to sort of respond to their needs. So I don't want to sort of go too much over all of this. There's sort of some models that we might explore. I think you need to sort of optimise what the statutory services are doing, but at the same time, that can't be all there is. We've got to do more in the middle and lower ends, and sort of prevention, engagement of families, engagement on a broader scale in communities, but engagement in a sort of targeted way, not sort of just general support. I think parents, it's quite clear, it doesn't matter what lens you use, you know, parents are struggling with their older kids, how to support them, how to help them grow, how to keep them in school, and so on and so forth, and how to stop them getting in trouble. So there's work that needs to be done there. There's probably more that can be done in the universal sort of programs within the classroom, in the communities, in sports, and in the community more broadly. But I won't go on about that. But I think the research, like Vincent's research, it's great because it provides a bit of quantitative confirmation. When we were doing parenting programs, we had the biggest effect sizes in primary school, early to middle primary school. It's much more diffuse the earlier you go, but there's a payoff. But in terms of impact on young people's behaviours, in terms of reconnecting them with families, the biggest and strongest effect sizes were in primary school age, engaging families, bringing kids and parents together in a group parenting program. So my feeling is this is the kind of missing space, in a sense, working beyond early childhood into middle childhood and onwards, as well as having that capacity to deal with particular areas of trauma associated with the levels of violence, the kind of levels of substance misuse and other things that kids are exposed to as they move through adolescence. From my point of view, what matters most for young people is relationships and responses between those who care, especially within families and among their peers, and sometimes from practitioners within services. And it's hard to do, but those relationships have to be there even when they're most likely to be rejected by the young person, and that's the toughest thing. So one of the young women in that inquest, you know, she was on a bender, she was drinking out with her mates, you know, on the grass out in the community. Her brother came and growled at her, she stabbed him, and then she took off. Clearly sort of her anxiety and suicidality was, you know, she was probably becoming suicidal. Then her mother finds her, or she finds her mother wanting something from her mother. Mother couldn't cope with her, calls the night patrol. She's dragged off again. So in other words, the relationships she needs most are the ones who are most struggling to connect with her, and so on. So there were other instances where similar things had happened, escalating family crisis, you know, sort of in a sense reflecting needs that the child can't or can no longer have met by those closest to her. So these are really difficult things. They're really hard to look at when you're a family member living through those sort of crises. We all fail as caregivers, and some of us hope we all hope we never have to confront that level of difficulty. But I think it's the most important area for us to be able to sort of think about what services, what responses we can help to build, and whether our service can actually contribute to that outcome of these kids' ability to kind of reconnect, sort of stabilise, sustain some level of relationship with people who are going to be there for them. Let's leave it there and have any questions. So if I could just say, one of the things we're doing as I'm trying to sort of shape up thinking about a next stage process to review suicides over the last 20 odd years, is to think about it somewhat thematically, because we know that experiences have changed. We know some of the causes and precipitants of suicide have changed somewhat. Sometimes that's superficial, these difficulties in relationships and about feelings about self and need for help from others are always part of the picture to some extent. But, you know, if we're thinking about the levels of assault and partner violence that occur, that's clearly part of the profile for young females. But for young guys caught up in violence, substance abuse and what have you, that's part of it. So we're thinking, I mean, one of the things I'm toying with is once we've mapped out the basic terrain of causes of death and so on, looking at it thematically in terms of what each case tells us from earlier to later, you know, till death, and what responses may potentially have been able to make a difference through that. Because the trouble is, when we look at it quantitatively and we can see the child protection system is telling us, yes, there's something wrong here, it's not telling us enough about what we should do about it. And somehow we need to be able to look closely at some of these cases and think, okay, what clinically, what socially, what psychologically might have been intervention points that we could think about developing further. So, yeah.
Any questions?